Good afternoon, everyone. Before we begin our presentation today, allow us to introduce ourselves. My name is Maria and my friend is Desi. We are 6th semester students of the Radiology Study Program, Widyahazada, University, Semarang. We are pleased to be here to discuss diagnostic equipment for identifying cardiac abnormalities. There are 11 points we are going to discuss. Point 1 Kinds of heart disease. Point 2 Treatment of heart disease. Point 3 Causes of heart disease. Point 4 Prevention of heart disease. Point 5 Diagnosis of heart disease. Point 6 Electrocardiogram. Point 7 Echocardiography. Point 8 Computed tomography, CT. Point 9 Magnetic resonance imaging, MRI. Point 10 Angiography. Point 11 Intravascular ultrasound, IVUS. I am going to talk about point 1 until 3 and 6 to 8, and my friend, Desi, is going to talk about point 4 until 5 and point 9 to 11. Point 1 is the kinds of heart disease. There are 3 kinds of heart disease: coronary artery disease, arrhythmia, and atherosclerosis. Point 2 is the treatment of heart disease. Heart disease can be treated by medication like atorvastatin, simvastatin, modulism, and lipanthiol supra, and surgical procedures like performing bypass surgery, installing a stent, installing a pacemaker, and inserting a balloon and inflating it. Point 3 is the causes of heart disease. Heart disease can be caused by smoking, blood pressure, alcohol, physical inactivity, overweight and obesity, unhealthy diet, and diabetes mellitus. Now my friend, Desi, will continue the presentation.
Thank you, Maria. Now I am going to talk about points 4 and 5. Point 4 is the prevention of heart disease. To prevent heart disease, we must exercise regularly, get regular checkups, reduce stress, eat a healthy heart diet, and stop smoking. Point 5 is the diagnosis of heart disease. Heart disease can be diagnosed by medical history, physical examination, and diagnostic tests like blood tests and echocardiogram. Now my friend Maria will continue the presentation.
Thank you, Daisy. Now I am going to talk about points 6, 7, and 8. Point 6 is electrocardiogram. Electrocardiogram is a primary tool for diagnosing arrhythmias, which can detect irregularities in the heart's electrical activity. An ECG can also provide initial indications of coronary artery disease. Point 7 is echocardiography. This ultrasound-based imaging technique allows visualization of the heart structure and function, assisting in the diagnosis of structural heart disease, which can be related to coronary artery disease and atherosclerosis. Point 8 is computed tomography. Computed tomography is utilized for non-invasive detailed imaging of coronary artery disease, and it's particularly useful for detecting calcium deposits in the arteries, which may indicate atherosclerosis. Now my friend, Daisy, will continue the presentation.
Thank you, Maria. Now I am going to talk about points 9, 10, and 11. Point 9 is magnetic resonance imaging, MRI. Cardiac MRI provides comprehensive imaging of the heart and is useful for assessing the anatomy, function, and characterizing tissues, which helps in the diagnosis of atherosclerosis and other heart diseases. Point 10 is angiography. Invasive angiography is considered the gold standard for the diagnosis of coronary artery disease, where dye is injected into the coronary arteries to visualize blockages with X-rays. Point 11 is intravascular ultrasound. Intravascular ultrasound is often used during cardiac catheterization, providing detailed images of the inside of the coronary arteries and can identify atherosclerosis. That's all about our presentation, and thank you for listening.